Pulmonary rehabilitation programs are interventions that are meant to improve the quality of life and day-to-day activities for people that have chronic lung disease. Pulmonary rehabilitation programs are typically found in hospitals, in their outpatient clinics, but you may also find them in community centers and health units in your area. So what are they? They're run by healthcare professionals. Often a physician is the director. Physiotherapists, respiratory therapists, nurses are all involved. People that have a chronic lung disease are referred by their doctor, and they come to a pulmonary rehab program for exercise and education. So the exercise part is a key part of pulmonary rehabilitation, and I know it can sound a bit intimidating for someone that has a chronic lung disease, but it's actually the number one thing that people can do to be able to maintain independence and quality of life. So the exercises are really geared towards the individual. People in the pulmonary rehabilitation program are all exercising at their own level. They get an exercise test when they start. The exercise prescription is really geared to them specifically. They work at their own pace, and they're supervised and guided throughout the whole program. Another key part of pulmonary rehabilitation is the education. It's really important when you're handling a chronic lung disease such as pulmonary fibrosis to really have a good understanding about what the condition is, how to manage flare-ups, what the different medicines do, how to handle energy conservation issues. And so the pulmonary rehabilitation program helps provide that information so that you're able and feel more confident in managing your chronic condition at home. These programs typically run for about 6 to 8 weeks. And as I mentioned, they're often in outpatient departments of hospitals, but you may find a pulmonary rehab program in your own community that is in a YMCA, or a community center, or sometimes the health units have the programs there. So they're really found in a variety of different places, but they're all similar in that they're run by a healthcare professional who has expertise in working with people that have chronic lung disease. So participants of the program come 2 to 3 times a week, usually for about 2 hours. So some portion of that is the exercise, and some portion of that is the education. And a key part of the pulmonary rehabilitation program is that it's done in a group. So it's not just you by yourself. You have the opportunity to meet and interact with other people that have chronic lung diseases, such as chronic obstructive pulmonary disease or pulmonary fibrosis. And that ability to interact with other people and gain some knowledge just from sharing your experience and them sharing their experiences is really a key part of the support that you get from a pulmonary rehab program. So the rehab programs really have a lot of fantastic benefits. The number one probably benefit, I would say, is that both people notice an improvement in their ability to be active and also a reduction in their shortness of breath. So because the exercises are specifically tailored for you, you can see an improvement in your activity over the course of that 7 weeks. So you may find that if you did a walking test in the rehab program and you could walk, say, 300 meters, after a pulmonary rehab program, you may be able to walk another 50 to 100 meters. And that can make the difference for some people to be able to move around easily in their own home or to be able to walk and do activities outside of their home. Another key part of pulmonary rehab is the ability to handle some of the issues with shortness of breath. And so when our muscles get stronger and when we get a little bit more fit, we have less of a demand on our lungs for oxygen. And that in turn can reduce that real shortness of breath that people with pulmonary fibrosis often have. We can also show people how to tailor their activities and their energy level, and so people can handle their fatigue a little bit differently. So these benefits have all been demonstrated in really excellent research studies, some done here in Vancouver. And so the evidence is really becoming quite clear that pulmonary rehab has a real benefit on symptoms and activity tolerance for most people.
So Dr. Camp, if a patient was interested in this program, how do they access it?
So the first key is to see if there is one in your community. And the BC Lung Association does maintain a list of pulmonary rehab programs in British Columbia. And so if you want to go on their website or give them a call, they may be able to point you in the right direction. You may also ask your family physician or your respirologist if they know of a program in the community. You could also call your hospital and ask to either speak with someone in the respiratory therapy department or the physiotherapy department and see if there is a pulmonary rehab program in your community. If there is, then you typically need a doctor's referral, and this can actually come from your family physician. So the family physician can provide the referral, and they usually also provide some information about your medical history as well as your pulmonary function tests. Then that gets sent to the rehab program, and the rehab program will call you and ask you to come in for an initial assessment. And those assessments usually involve getting to know you a little bit better, finding out what your goals are for joining the rehab program and what you're finding difficulty with, and then having you do some exercise tests, simple walking tests usually, to get an understanding about your basic level of exercise tolerance. And from there, they can start to create a program for you.